Hello and welcome to this edition of Your Health, Your Wealth. I'm your host, Dr. Eddie Patton, and I'm excited about today's edition and what we're going to talk about today. I have two very special guests with me, and we're going to be talking about the cost of chronic disease and specifically talking about dementia and Alzheimer's disease and caring for people with Alzheimer's disease and memory loss. In the past 2 or 3 years, we've had a couple of new medications that have been approved for Alzheimer's disease, and we're excited about that. But what we don't talk about enough is the economic impact to caregivers and those who are actually taking care of patients who have memory loss. So just to make sure we're all on the same page, because I will use some of these terms interchangeably. When I talk about dementia, for those who don't know, dementia really is an older term that we use for any condition that causes progressive memory loss. But there are different types of dementia, and within those types, Alzheimer's disease is the most common. We'll talk a little bit more about Alzheimer's disease, but in general, the trends and the different things we see are pretty much the same for all caregivers who take care of people with these, what we call degenerative neurocognitive or memory issues. So let me introduce my guests, and they're going to have a chance to talk a little bit more about their history. But I have two very special guests that are very special to me. We have Dr. Dona Murphy, who is a fellow neurologist. She's also a neuroscientist, a historian of science. She is a fellow of the American Leadership Forum and founder and CEO of Prognosus, which is a digital health company that is centered around caring for people with dementia and with a special attention on cultural competency. And my other guest, Minnie Stamos, and she is a caregiver for her mother who has Alzheimer's disease. And the unique thing about Minnie and her journey, and why I thought it's important for y'all to hear from her, is that she, along with being a caregiver, she's also caring for herself, she has a chronic neurological condition herself. So we'll dive into that. I pulled a couple of stats from, and this is all public knowledge, from the Alzheimer's Association. The lifetime cost of dementia is estimated to be nearly $395,000, including the value of unpaid caregivers. And each year, a family spends on average more than $10,000 to pay out-of-pocket health expenditures for seniors with Alzheimer's and dementia. This is more than 4 times greater than the average annual out-of-pocket cost for seniors without dementia. And in the last 5 years of life of a person with dementia, the family out-of-pocket health care expenditures is nearly $90,000, and this is more than twice as high as caring for a person with cancer and nearly 75% higher than taking care of someone with heart disease. So on average, the out-of-pocket health care spending in the last 5 years of life of a person with dementia consumes a third of a family's wealth. And for a Black family, dementia in the last 5 years of life consumes on average 80% of a family's assets. So when we look at treatment for Alzheimer's disease, and we're very excited about these new treatments and these innovative treatments that we have, and to be able to really impact the disease, but these are really staggering numbers when we talk about the caregivers. So I want to go to you, Minnie, first. And when we look at these numbers, are they real? And by that, I mean, I'd like for you to share some of your experiences as a caregiver taking care of someone with Alzheimer's.
Just to hear you talk about it, the first thing that comes to my head is how overwhelming it is. I'm a photographer, and like you had said, I have my own neurological disorder, and just having to drop everything or move appointments or change my doctor's appointments to take her to her doctor's appointments, to go get her prescriptions and to be there. And it's $500. And well, I can't do it. We're going to have to find something else for you to take. It's very costly. It's very demanding. It's very overwhelming.
And just to piggyback on what you were saying, some other financial statistics that they talk about in this impact report is just that among care contributors, those who are caregivers for Alzheimer's had to cut back 48% of their own expenses, including food, transportation, medical care, to pay for dementia-related care. And part of the thing that I think people don't appreciate or think about enough is that when someone has dementia or memory loss, and depending on the degree, it really is a lot that you have to do as a caregiver, and a lot of things that we take for granted are small things that you have to do as a caregiver.
So my sister and I, when Mom started getting worse, we're like, okay, we're Greek, as you know, and you don't put your parents in home. It's just on us to take care of them. So we decided that we were going to buy a house and we were all going to live together. And she travels with work, so most of it falls on me. So initially it was a great idea because I thought I was going to have help, but she's gone most of the time. So it's hard because, so many doctor's appointments, just what dementia, Alzheimer's has done to her. She's a completely different person. She goes from 0 to 60 in 2 seconds. Yeah. We just never know what we're going to get. We're horrible kids. We don't help her. We don't take care of her. Last time I brought her to an appointment, you're like, hey, how are you guys doing? And I said, well, one of us is going to be dead and one of us is going to be in jail. Can you guess who's going to do what? And I know it's horrible to think that way. And we just, find laughter and everything. And that's how we make it through. That's how we get by.
Yeah. And I will tell listeners, we were talking about this off air in a fun way, because I've known this family for a long time, the Stamos family, and they are so fun. Our visits are usually a lot longer because we sit there and talk, but yeah, you do know when they're there because you can hear them up the hallway. But it's in love. It's in love. It's a cultural thing. So, and it's all in love. So. But speaking of that cultural aspect of caregiving, Donna, you have done a lot when it comes to dealing with caregivers. Say you're a neurologist, you know all about treating the disease, but you decided to shift and do a lot more work in this caregiver space, specifically looking at socioeconomic disadvantages and cultural differences amongst taking care of patients with dementia. So tell us a little bit more about some of those cultural differences that you see in families taking care of patients with dementia.
Sure. I think it's important here to maybe motivate that with why it's important to look at those socioeconomic and cultural differences. And that is because these communities are disproportionately impacted by dementia, and there isn't enough in the way of resources at any level, diagnosis, treatment, counsel, care, community, that is adapted for people of these various kinds of circumstances. So when we think about all of those different dimensions, culture has a huge impact in terms of whether somebody wants to be diagnosed, whether that diagnosis should involve the family, whether the person themselves who has the symptoms should be involved in terms of their own knowledge of their condition, right? That's very culturally informed. The treatment, whether to pursue treatment, also, I think that really depends on what your cultural background is and your understanding of what that treatment does for you. I think that's more than culture alone. It's other things like individual preferences, maybe family values as well. So those things also inform that decision, given that treatment is limited in dementia, what it can actually do for you and what the risks are also, especially with some of the new treatments that have been developed. In terms of counsel, totally culturally embedded, what actually works for you in terms of what people are suggesting that you do to manage some of the very difficult, especially behavioral symptoms that people have with dementia, especially when you're trying to care for them in your own home. And how you navigate that it has everything to do with what your cultural background is, how you actually engage with, if it's your parent or your spouse, your sister, whoever it is you're caring for. Those family dynamics also might be very much influenced by culture, right? So, and that's a part of how you navigate those situations. So like really every aspect of this journey is informed by culture, but unfortunately, so much of what you find out there in the way of counsel, it's not tailored to any given culture.
Yeah.
Yeah.
No, I agree 100%. And we see it every day. And a lot of the visit or time that I'm in the office or in the actual patient room with the patient, a lot of the time or most of the time is actually talking to the caregiver and not just, the patient, because I call it being pleasantly demented. A lot of times, either the patient doesn't realize or they don't understand the magnitude of what's going on, especially from some of the behavior issues and different things like that. So there's a lot of time that we actually have to counsel caregivers on how to deal with the mental health aspect of it. This is, especially if you're taking care of like your mom or dad or a loved one that took care of you, and now later in life, you're taking care of them. But you've got your own family. You've got kids. You've got a house and different things. So that role reversal is somewhat difficult. And that's why I think it's important that we have these conversations and resources. Now, what are some resources for caregivers who are at their wits' end and just reaching for help?
Sure. So the one thing that is, you're not necessarily going to get something that is super culturally tailored, but I think they definitely are a great clearinghouse for community-based organizations, and connections to resources through those organizations is the Area Agency on Aging, which is everywhere across the United States. So you should be able to find one that is closest to you. That is a great place to start. They have advisors there that will help you navigate kind of the economics of this. And if you're thinking about maybe switching your loved one from Medicare Advantage to Medicare, because some of the new support that we have through Medicare specifically for patient caregiver dyads, whether you're thinking about different aspects of care that may require a case manager. Those case managers can also be accessed through your Area Agency on Aging. They're specifically designed to help people who are kind of lower income, lower resource people, families, so that they can have access to a lot of these different kinds of things. So I would start there. As far as things that are culturally tailored, I will say we've done an extensive survey of what exists out there, and there are very few resources. In California, and I think, some of their resources are generalizable to other parts of the United States. There's something called the Family Caregiver Alliance. They have some tailored resources in different languages, caregiver stories that is kind of culturally adapted. But this is why we started Prognosus, largely because those things don't exist. And we think that, community is also such a key piece of kind of getting through this journey. And that where it exists, again, is not tailored for culture. So, if you go to a support group locally, right? It's typically in English. It's typically not very accessible, especially for people who are often kind of bound to the home because they're caring for another adult, who can't really go everywhere all the time. And they're in English. I don't know if I mentioned that. And so we actually make it a point to make sessions more accessible. They're virtual for us. We make sessions facilitated by people who are from disproportionately impacted communities, who speak the language of those communities. We deliberately recruit other folks from those communities so that when you end up in a support group, you will find your experience reflected in the experiences of the other people there with you.
That is awesome. And Minnie, have you taken part in any support groups or participate? And have you found a community that knows about dementia and Alzheimer's that has been able to kind of help you along this journey as a caregiver?
Right now, I'm just so excited that Dr. Murphy is sitting next to me, because seriously though, I had no idea that any of this even existed. And I'm going to get all the information and I'm going to talk about it and I'm going to pass it along to other people.
And that's the power of why I wanted to get this information out there, because you're not alone. I don't think enough caregivers know, or they're so busy with just trying to balance their own life and taking care of their loved one that they don't have time or energy to really reach out. I mean, when I talk to caregivers, I mean, literally once they go through their day, they're so exhausted. I've had some patients' family members that I've had to do relationship counseling on because, she couldn't go out and have a relationship with someone because every time she would leave the house to go out on a date or something, there was issues. So it's the little things that we all take for granted. I don't think we pay enough attention to.
Right. Just everyday life. It's even what you were just saying about your patient. I'm 58 years old, and my mother, when I leave the house, I feel like I'm 16 again. She's just all over the place.
More than half of caregivers report high or very high levels of emotional stress, and more than 1/3 report high levels of physical stress. 1 in 5 care contributors have to cut back on their own doctor visits in order to take care of their loved one. And among Alzheimer's caregivers, 74% report they are somewhat to very concerned about maintaining their own health since becoming a caregiver. And that kind of, I was amazed at it. More than 1 in 3 Alzheimer's caregivers say their health has gotten worse due to their care responsibilities, compared with only 19% of non-dementia caregivers. As I mentioned earlier, Minnie, you have a neurological condition yourself.
Yes.
So when you hear stats like that, what is your take on that? And how do you take care of yourself when taking care of someone else?
I know that I should take care of myself more than I do, because if I'm okay, then I can take care of her. But everything you just said is so true. I put myself on the back burner because I feel like I need to take care of her. But I know better than that. But it's too hard.
It's important as a clinician that we step back and look at the whole picture and make sure that as we're talking to not only our patients, but also their caregivers, that we make sure that you're okay, not just physically with physical health, but also psychologically, because being a caregiver can have, take a psychological toll. Do you want to say anything on that, Donna?
Yeah, so I often am thinking about the toll of this disease, not only in terms of the economic toll, but also in terms of the health and social costs. Yes, everything that you said there is absolutely true. And I think it's important to also recognize that women are overwhelmingly the people who take on this caregiving role.
Absolutely.
So, we comprise about 2/3 of all of the caregivers in general, but also that applies in dementia. And that, it creates a lot of additional, I think, problems for women as individuals, but also like societally in terms of gender disparities. It exacerbates those disparities. I think we internalize a lot as women in terms of what our duty is to care. It's culturally just very strong across many different cultures, actually. Many cultures are very paternalistic. There is this expectation that we end up internalizing, and we feel guilty for not actually fulfilling those roles. So I think it is important to to be in community with people who understand that, and to see models of how people are navigating that effectively, so that they are able to actually prioritize themselves enough that they that this experience is not really fundamentally detrimental for them, right? Because eventually, in all likelihood, the people that we care for will pass, and we will outlive them eventually, for most of us. And in that case, what happens to us if we have allowed ourselves to, to be in a circumstance where we are personally devastated in terms of our health, in terms of the social costs of the disease, right? Absolutely. It's very isolating. So what, for 10, 15, 20 years, we're going to now like have less and less connection to our friends, to our colleagues, to, other people in society. So again, when this person that has become all of our life, has, consumed all of our attention for all of that time is no longer with us, what happens to us socially?
Sticking with that, share with us a little bit more about your personal journey in this arena and what led you to put together and found Prognosus. And what exactly is Prognosus?
I'll try to be brief about the personal journey. I think you mentioned some aspects that are relevant, which is that I come from a neurology and neuroscience background. I thought what I was going to be doing kind of in this space, I was trying to pull together my personal values and my professional experience and know-how. And I thought what I was doing is developing a diagnostic biomarker in the disease, which is very hot, very popular. A lot of people have great interest in this scientifically. People want to invest in it. And I thought that was a path for me where I can bring those things together. But when I started talking to families, which I thought was fundamental to really understand, like, what are the pain points for the people who actually live this? And I will say the other important piece of this is that I actually live this. So I have two people currently in my family who are biologically related to me, my father and my grandmother, who have mild cognitive impairment, which is a precursor to dementia. It doesn't always progress, but generally does with time, of course. Mm-hmm. We know. My grandmother has mild dementia. I have a father-in-law who has severe dementia. I have an adoptive father who has severe dementia, all still living. I have two grandparents who we lost to dementia. And then because I have a personal history of brain infection, have a 31-fold risk of dementia. So this thing is all around me. I cannot escape it personally. And I figured I should use that perspective also to inform what I'm doing. And I went straight to the families of the people who are caring for those living with this disease, because I think it's a little bit more challenging unless you can get people at the beginning of the disease themselves for me to, kind of engage with them in a way that informs what I'm doing, right? Because of the nature of the disease is that it becomes more difficult to communicate with people living with dementia themselves. So I went to the caregivers to see what their experience has been. And for them, the diagnosis was challenging when I was thinking to do this diagnostic biomarker, but it was not the thing that was most challenging. Yeah. They all said that the thing that was most challenging came after diagnosis. And at that moment and thereafter, they felt abandoned by the medical establishment. They felt very isolated. It was exhausting to do this work. They felt that all of their social connections were being frayed as a result of the work that they had chosen to take on. And when I heard this enough, I was like, okay, I could work on that technical challenge of coming up with a diagnostic biomarker, or I could listen to these families. And what I thought was necessary was to leverage technology in order to connect people to each other and to resources, and to do so in a way. And again, this is a reflection of my personal experience, having a father who speaks more Korean than he speaks English, and especially with now his cognitive issues, where people who are bilingual or multilingual start reverting to their primary language. It was difficult to get him to a doctor who could talk to him, right? So we found a Korean-speaking doctor, but she also isn't fluent in Korean, right? But that was the best we could do. She's wonderful. She can speak enough Korean to communicate with him at a basic level, and that was comforting for him and for my mother. And so this was not easy to find. And, these spaces that I'm talking about in terms of like a community of caregivers who are kind of going through the same thing at the same time, ideally in the same place, it hardly exists.
Yeah.
And so that's where I figured I need to focus my attention. And that is what Prognosus is. It does have tools to help you kind of give people an educational look at like what these symptoms might be caused by. So we have a screening tool and a staging tool. They are not a replacement for a doctor who actually makes a formal diagnosis. But if you are waiting to get that appointment, if you have many other reasons, stigma, the cost of that appointment, many other things that you're navigating to actually get that to happen, this is, something that will at least give you some idea of what might be happening and how you can manage that at home. And we have a whole caregiver story library now in English, Spanish, Korean, and Mandarin, or in Chinese. And that also, it's like everything dementia. You can look it up in a searchable with a search bar and by symptom, by other aspects of disease management. Again, with this idea that most of us coming from our very diverse communities are trying to do this work at home. But we do talk about transitions in care if people are looking at that as well eventually. And then we also offer these caregiving communities, which are facilitated spaces. They're weekly. They're in English and in Spanish. Like I said, we're very intentional about trying to recruit diverse caregivers so that we can build communities that really are reflective of the experiences of the people who are disproportionately impacted.
You use the word community a lot in your response, and that's so true. And my personal philosophy and how I do things, particularly when I'm about to give a diagnosis, where diagnosing someone with Alzheimer's, is I tell them to bring any family member that's going to be involved in your care to this next visit. When we all talk, and we bring in chairs, we'll fill the room, because it's important. Because this is a community diagnosis, and there's so many things that have to be discussed at every level, from mild, moderate to severe, like driving. Driving is one of the key things that I talk about quite often, because there's something about taking away your independence when you take away that ability to drive. But it's not only that. It's also talking about medical legal issues. Have you all talked about dual power of attorney for healthcare? It's financially making sure that things are in place so that when things get to a point where that person is not able to make those decisions for themselves, that they've already talked with the family, made sure that financially things are in place. So it is a community diagnosis. And I do wish that there were more resources like Prognosis, where we can steer families to get that type of advice and counseling that they need. So, Minnie, in closing, if you were to and use this platform to talk to other family members, maybe it's that visit where their mom or dad is getting a diagnosis of dementia or Alzheimer's disease, just what are some of the things that you would say to them? Questions to ask, things that they should think about as they get ready to embark on this journey as a caregiver?
It's hard. I would tell people to just take a deep breath and be patient and be really, really open with your doctor, and just ask a lot of questions, write them down before your appointment, and go to Dr. Patton, because he is going to spend so much time with you. Seriously, I know we're laughing, but you do. We've been to so many neurologists. I just applaud you because you spend so much time with us. You answer all of our questions. You call back immediately. I just think it's great. Just find a doctor that gets you, ask a lot of questions.
Absolutely.
And everything's going to be okay.
I love it. I love it.
I want to tell you, Minnie, and anybody who is a caregiver, that the work that you are doing, you don't have to do, and that you have chosen to do that work is pretty extraordinary. And we should all have gratitude, because that is not your responsibility. It's the responsibility of society to care for our older people. And so I thank you. I applaud you. I do think it is so crucial, as I've mentioned multiple times in this podcast, to really connect with the people who are going through similar things. Locally. Ideally, those people are local to you. If you're in Houston, Harris County, we're definitely your solution. We're also trying to expand in Seattle, which is where I spend my, another part of my time. But if you're in other parts of the country, we welcome you to our spaces. Because they are virtual, we can accommodate people from anywhere across the United States. And actually, right now, we're expanding to Ecuador as a function of some of my connections in Ecuador in Spanish. But yeah, that will be better than nothing, 100%. We do have people joining from New Jersey, from Virginia, from California, from other places. But I do think that local solution is actually ideally the best. Unfortunately, it's that most people don't have the culturally tailored local solution, which is why we're here. So please do reach out. Our website is www.prognosus, and that is spelled with the US, PROGNOSUS.com. It was intentional spelling it that way. And the idea is that this journey is a lot different with us together than I alone.
That is so powerful. And I just want to thank both of you all for joining me today. So much great information, and I hope listeners come away with a better understanding, not just of the economic impact of caregivers but also the social and what all it means to take care of someone with this disease, and realize that there are resources out there. There's help out there. Reach out, talk to your doctor, communicate, become part of a community, and we'll continue to tackle this thing together. And we look forward to talking with you more at future episodes of Your Health, Your Wealth.